Over the last few months with COVID-19, it's led to a lot of social isolation, which actually made me wonder, what about folks with hearing loss? Does that actually affect whether they socially isolate themselves? Well, I'm out here with Dr. Gnewikow at Audiology Hearing Aid Associates to find out more.
I think it's a real issue. In other sessions have referred to Helen Keller, who was a 19th century activist who was born deaf and blind, and basically her comment in one of her writings was that blindness separates people from things, but hearing loss separates people from people. And, you look at the population as we get older, our kids move away, our spouse is ill, so a lot of times we are becoming isolated to some degree anyway. And then we start to have hearing loss on top of it, which tends to exaggerate that isolation. You get into a conversational situation with someone and you give them a dumb answer. How are you feeling? 7:30, and everybody laughs but you, and it wasn't that you didn't know the answer, you didn't hear the question, and it's not funny to you, but you laugh just to kind of cover it up. But it's embarrassing. And so after a while, when you start missing things in conversation, you start smiling, shaking your head when you have no idea what they said, so you're basically faking it. But after a while, even that gets old. And so you start to think, I just don't want to put myself into those situations anymore. We went out to dinner with the Joneses last night, and I was kind of a wallflower. I understood some of the things that were said, but a lot of the things I just nodded and smiled like I was a part of the conversation. And so little by little, people that have significant hearing loss start to withdraw. They almost start pulling into a shell. People that live completely alone, it's even a bigger issue. And as you pull into a shell and you become more isolated, you're not social anymore, which I hear from a lot of patients from their spouse. My husband just doesn't want to do anything with people anymore. That really has an effect on your quality of life. So clearly, Helen Keller was right. Hearing separates you from people. It separates your emotions. So do what you can. You can't always resolve the issue of hearing loss, but those of you that have a hearing loss know exactly what I'm saying because you've done the same thing. I've done the same thing because I've had a hearing loss for a number of years, and in many situations, even when I have hearing aids on, I still miss some things, and I still tend to fake it a little bit. But quality of life is more and more important as we get older. And if there are things you can do about it, do what you can do. Check with your physician, check with your audiologist. If you don't have a hearing loss, it's not an issue. It may be coming from something else. But if you've got a hearing loss, it's really adding to your isolation. Sometimes hearing loss can be fixed medically through surgery, depending on the type of hearing loss you have. Most people can be either fixed or significantly improved with the use of hearing aids, which is probably the most common rehabilitative technique. And for those people who can't use hearing aids and who can't have surgery, then there's always the light at the end of the tunnel, which is the cochlear implant, which is done for people who are profoundly deaf. So whether it's a medical treatment, whether it's a hearing aid, whether it's a cochlear implant, do what you can. Don't isolate yourself. Hearing loss affects our emotions, it affects our cognitive function, it affects our anxiety, and there are some things that you can do about it.
And if you'd like to learn more, Audiology Hearing Aid Associates has 2 area locations in Lynchburg, 434-528-4245, in the Danville area, 434-799-6288. Also more information online at digitalhearingforyou.com.